So if you are looking to get pregnant, you have but mere hours to make it happen, to make sure that the sperm is hitting the egg. So we are going to continue on our menstrual masterclass. We are now heading into week 3, or the luteal phase of the menstrual cycle. So up until this point, we have been talking all about the follicular phase of the menstrual cycle. So week 1 and week 2. And if you haven't watched those yet, I highly recommend that you go back, take a couple minutes, watch week 1 so you know what's going on in bleed week, and watch week 2 so you know what's going on in that pre-ovulatory week. And then, of course, week 2 ends in ovulation, right? So ovulation is going to, we ovulate somewhere between 10 to say 36 hours after that luteinizing hormone surge. And we can't actually test that. We don't know exactly when luteinizing hormone surges, but we talked about this last week. Luteinizing hormone is the hormone that is involved in helping release the egg from the follicle. Now, I will say, once you release an egg, ladies, depending on the health of the egg, it is only around for hours, 4 to 24 hours, usually on the high end. So if you are looking to get pregnant, you have but mere hours to make it happen, to make sure that the sperm is hitting the egg. So the best, if you are looking to get pregnant, the best chance of that is to make sure that the sperm is already there, waiting in the tube to surround that egg once she arrives. So having sex, of course, at ovulation is important. But because it's just hours, 4 hours to 24 hours, what is more important is having sex before ovulation happens, because sperm can live up to 5 days. I know. Like, they pack a little luggage with them and some food, and like, they're good for 5 days. Okay. So ovulation is the end of the follicular phase and the beginning of the luteal phase. So once you ovulate, now the theca and the granulosa cells, which we are very, very important in the follicular phase, now convert into the corpus luteum. Now we call them lutein cells. And these cells now start to produce progesterone. And as a natural consequence, your progesterone starts to rise. Now, as a note for all my ladies who are looking to get pregnant, progesterone, and therefore your body temperature, only rises after you've ovulated. It's worth saying again, progesterone rises only after ovulation. This drives up core body temperature because progesterone is generally warming. And so when your temperature starts to spike, you've already ovulated. Okay. So we have that. And this is important because you just have hours to get pregnant. Contrary to what the nuns told me when I was growing up, that I could get pregnant from going into a swimming pool. You can't get pregnant all through the month. Okay. And I think that was used more of a scare tactic rather than actual fact. But for women, we can only get pregnant like literally hours out of the entire month. Okay. So the temperature spike that you see if you're doing that basal body temperature means that you're producing progesterone and that ovulation has already occurred. So once progesterone rises, now it's going to prime the endometrium for implantation. And so progesterone is I like to call her like just a little bit savage, because she now reduces estradiol's role in the development of the endometrium. She decreases the concentration of estrogen receptors in the endometrium. And pardon me for anthropomorphizing everyone, but I feel like progesterone is just like, I'm here now. I'm the principessa. I'm the princess. Like, no one else needs to be here now, right? So we have progesterone's around. She's like, you know what? The estrogen receptors in the endometrium, we don't really need you anymore. And then sort of as like to add insult to injury, if you will, progesterone also increases the enzymes that convert estradiol to estrone. It's like, so for me, that's like really, I think that's, first, I have so much reverence for our bodies, but I just think that that's so interesting. Okay. So what she's doing, progesterone's doing is basically rendering estradiol neutral. Okay. And as a note, coming back to ovulation for a minute, prostaglandins, very important for implantation, right? So some women around ovulation can experience something called Mittelsmärch, which is from the German word Mittel, meaning middle, and Smerch, meaning pain. So some women will have this Mittelsmärch where they will feel pain around ovulation. Even just like the release from the egg from the follicle can create pain in some women. And so because we have normalized pain so much around menstruation in our culture, it is very, or I'll say it is very common to take pain medication, NSAIDs, things like that to manage that pain. However, when we take pain medication like NSAIDs, this will reduce the probability of implantation because it will reduce the role it will reduce the total amount of prostaglandins. Okay, so prostaglandins like basically increase your cramping. So if you feel that kind of crampiness middle of your cycle and you want to get pregnant, stay away from the painkillers. Okay, so now we are in the luteal phase. A healthy luteal phase is typically a squeak longer than the follicular phase. So somewhere between 12 and 16 days. Under 12, we call this a luteal phase defect. And that will affect how much progesterone is made and potentially implantation as well. So while we're in week 3, from a hormonal perspective, we've been talking about progesterone's role. She's a bit savage. She's like, I'm the queen. Everyone else does not need to be here anymore. Off with their head, as they say. So in week 3, right after ovulation. So if you remember from week 2, we have this like meteoric rise in estradiol. Right after that, so it's high for 50 hours or so in that week 2 pre-ovulation, and then it drops. And then so in week 3, we're still on the cusp of that drop. We have this initial low drop in estrogen for a few days, and then towards the middle and end of week 3, we will start to see estrogen rising again, and it stays elevated there for about a week. And so you have this sort of we'll say transient hormonal environment that looks a lot like week 1 of your cycle, right? Low levels of estrogen initially, low levels of FSH, which in week 3 is now being inhibited actively. And then the only real difference is now we're seeing a progesterone that's rising. So from a nutritional perspective, this is we will also see changes in our metabolism in the luteal phase of our cycle. So one of the things that I want to mention here is my perimenopausal women, because perimenopausal women, after the age of about 35, we have declining levels of progesterone. So your PMS symptoms can be exacerbated if you're not following some of the suggestions, let's say, that I am giving around lifestyle in terms of building muscle and eating in terms of your cycle and stress management. And of course, there are, these sex hormones naturally decline with age, but we can mitigate how badly these PMS symptoms can be. And progesterone in general is a very, I think we often think about it as the pregnancy hormone. The name is kind of built in like progestation, progesterone. But it really does, progesterone has wide ranging effects on the body. So in the breasts, for example, it will help reduce breast tenderness and inhibit the formation of cysts. It helps prepare the breast for milk production through the course of pregnancy, helps prevent the onset of cancer by counteracting the effect of excessive estrogen. So if you are a woman who in the luteal phase of her cycle, like your breasts, are very tender and angry, particularly the nipples, or you kind of feel like your breasts are more lumpy and bumpy, it may be because your balance of estrogen and progesterone is off. Of course, gynecologically has effects on, obviously shedding the endometrial lining each month, prevents ovarian cancer in the vagina. Progesterone causes small volumes of thick cervical mucus to be secreted that is impenetrable by sperm. It's sort of like it's like Captain America's like big shield. That's what I think of. Anyway, this increased viscosity, right? This sort of like, this big shield protects the cervix from ascending infection at the time of implantation, right? Because if you think about it, the vagina is and the uterus, it's not encased by anything. It's sort of free floating in the abdomen. And of course, we can have ascending opportunistic pathogens that can come in with the sperm that can cause and wreak havoc. So very, very important progesterone's role in the vagina, in the uterus as well. In the brain, progesterone binds to all brain cell receptors, like metabolizes allopregnanolone in brain tissues, produces this calming and like anti-anxiety effect, memory enhancing effects as well. It's like the chill. It like helps our brains like chill the F out a little bit. And of course, it also protects the brain and helps it repair after injury by encouraging the growth and repair of the myelin sheath. And this is really important if you've ever had a concussion or you've ever known someone, a female in particular, having a concussion. She has a much better prognosis if the injury happened in the follicular phase of her cycle. Now, why is that? Because she has in the next couple of in the next week or two, the full onslaught of progesterone to help repair the damaged neuronal tissues from that concussion. And I would see this all the time in practice. Whenever a woman would come in with a concussion, I wanted to know exactly where she was in her cycle, which initially sort of caused like a hairy eyeball, like, why the hell is she asking me this? But we know, of course, that progesterone helps to promote injury repair, and specifically in the brain, the myelin sheath that protects the nerve fibers. A couple other things I just want to like highlight for you in terms of why progesterone. We love progesterone. Pivotal role in bone mass and anti-resorptive measures. So I've mentioned before that muscle always constantly remodeling, bones constantly remodeling. The effect that progesterone and estrogen have together increases bone mineral density and decreases the risk of fracture. Okay. It also, progesterone will activate cells called osteoblasts, which will increase new bone formation. Has other wide-ranging effects on the body, like the cardiovascular system, to help promote lower blood pressure, inhibit coronary hyperactivity. It helps with the immune system, increases levels of, we'll say, anti-inflammatory agents. Because you can go down a whole rabbit hole with immunity as well, but we'll say it increases the level of anti-inflammatory agents, helps kidneys and liver, so it helps with sodium excretion, et cetera. Okay, so we know that progesterone is important. So from a nutritional perspective, because we have a hormonal milieu that looks very much like that first week of the cycle, I typically, if you're a cycling woman, a woman in her reproductive years, come back to that ketogenic style diet with a heavy focus on greens. So lots of the green leafy vegetables, good quality fats, and proteins. And this is going to help your estrogen metabolism in general. Okay. So if you are someone who typically has PMS, you need your greens more now than ever, because when we eat foods that contain, and we talked about this a little bit in week one, but these diindyl methanes and these sulforaphanes, they are going to help estrogen metabolism specifically, so that we are going to get hydroxylation of the estrogen metabolite down, what is called the 2-hydroxyestrogen, either estrone or estradiol pathway. And this is going to help reduce some of the tenderness, let's say, in the breasts, for example, because this particular metabolite is an estrogen antagonist, meaning that it does not retain the ability, once the estrogen has gone down this particular pathway, it does not retain its ability anymore to activate the estrogen receptors in the breasts, right? So this is why, part of the reason why so many women with PMS, they get that tender breast, is because it's going down another metabolite pathway, and that's called the 4-OH or 4-hydroxy estrogen pathway. The other thing in this week that I like, especially when we're talking about PMS, is resistant starches. I have written articles about this. I've put this in my book. Resistant starches are the OG when we are talking about reducing cravings and we are helping with sleep. It's a food source for your microbes in the large intestine. And this week is really crucial because especially for cravings, because this is the week where we're going to see those cravings amplified. And you can really quell that with resistant starches. So when we're consuming resistant starches, the microbes in the large intestine kind of gobble it all up and they will produce something called a short chain fatty acid, one of them being butyrate. And this is, butyrate is one of the reasons why the relationship between the human race and our microbiome, the bugs and the critters in our microbiome has been described as symbiotic, because our shared existence is beneficial to both parties involved, right? In this case, our gut bacteria will digest like some of the plant fibers or the resistant starches and turn them into these SCFAs, these short chain fatty acids, which have benefits like sleep, it helps with, it's like I always say butyrate, remember, like beauty sleep, helps with your cravings, helps with the, if you're someone who has like more leaky gut or you have digestive issues, it's going to help with it's going to provide fuel for the cells of our gut lining. I mean, there's just, I can't sing the praises of butyrate. There are other SCFAs, acetate, propionate, et cetera, but butyrate is sort of the big one that I want to focus on as well. And a couple more reasons before we kind of move on to movement. Butyrate functions as something called an HDAC inhibitor, which is, we won't go down that rabbit hole, but just know that this is like, it performs like anti-cancer, anti-inflammatory functions by suppressing the activity of like specific cells in the body. Okay. So we have our nutrition plan. We're going to go keto. We're going to do a female-centric ketogenic diet with resistant starches, lots of green leafy vegetables. In terms of fasting, this really depends on the patient, really depends on you, really. If you are, let's say, someone who does have a lot of PMS, maybe you run a bit estrogen dominant, you're wanting to be thinking about, helping estrogen metabolism and elimination, gut integrity, I would say that you can certainly fast, but I would be thinking about fasting with a bone broth or a soup or like a liquid type of fast, not the pure water fast that you often see kind of talked about. And then I wouldn't want to do too many long ones as well. And of course, there's always variation. Like I'm not giving specific recommendations here. Like you always need to be working with your healthcare provider to determine exactly what's right for you. If you are, morbidly obese, let's say, then you may be wanting to engage in fasting more often. If you're someone who's just trying to lose that last like kind of 10 to 20 pounds or 10 to 30 pounds or whatever, you may play with a caloric liquid fast one time in week 3. If you tend to be androgen dominant, we want to be driving towards better insulin regulation. So you still might want to do a water fast. You may want to do a caloric liquid fast. Again, this would be something that you decide with your primary healthcare provider. All right. And let's talk about training here. Movement, still lifting heavy. The theme has been all through your cycle. We lift heavy, but we change the set. We change the repetition as well. So here I would return back to kind of week 1 protocols where we're going like 8 to 12 moderate reps, but heavy weights. You shouldn't be able to do more reps with that weight. Okay. Cardio, again, as your little heart or big heart desires. It can be low intensity, steady state, which I always like to do some base amount every week. And then you can also throw in one, maybe a HIIT workout in here as well. Supplements, I definitely change the supplements up. Typically this week, I will start increasing magnesium because your body is basically building up this 5-star fluffy endometrial lining, lots of nutrients that are going there. So you just generally are going to be pushing more things like the glutathione and the zinc and the magnesium into that endometrial lining. So I love more magnesium, more zinc, If you are someone who struggles with her glucose regulation, you might consider berberine as well, but certainly not necessary. But if you do berberine, it's often recommended that it's like 500 milligrams before each meal, like 20 to 30 minutes before each meal. It'll still have an effect in terms of that postprandial or that post-meal glucose rise. All right. So that is week 3. We transition from being in the follicular phase to being in the luteal phase. We talked a lot about progesterone and how important this mighty hormone is on our brain, on our recovery, our breasts, our bones, our immune system, our heart, our kidney, et cetera. And hopefully you're getting an idea now of how things may change through the cycle. And next time we come back here for our menstrual masterclass, we are doing all things pre-period. So we're talking about the week before it all starts again in week 4. If you enjoyed that conversation and you want to learn more about hormones, check out this video right here. It's like you're not going to get where you want in a week, in a month. And I'm going to say, you can make progress. You can make progress in a month. You can make progress in 3 months, in a quarter, in a year. But sculpting the body that you want and reducing overall adiposity is a long-term game.